Thank you. I'm very honored and pleased to have a very great panel today. So as we have not much time, I will start now with one question. First, I will ask you to introduce yourself very shortly and to tell me what is the main challenge from your perspective when it comes to evaluating AI solutions and defining EU standards for evaluating it. So let's start maybe with Charlotte.
Thank you very much. Hello, everyone. So I'm an AI analyst at the CNIL, which is the French data protection authority. So our main challenge at the CNIL is to articulate the general data protection regulation with the new regulation, the AI Act, that entered into force this year. So just to make a short statement about what is the General Data Protection Regulation and how it is intricated with the new AI regulation. So basically, the GDPR provides a legal framework enabling individuals to reclaim control over the data powering information systems. So it grants individual rights to exercise control over their personal data through a set of principles such as transparency, justification, lawfulness, security safeguards, access and objection rights. And it is built on a principle-based logic and designed at the individual level and remains independent on technical interpretation. So this is important for AI because this makes the regulation both robust against technological innovation and broad in scope. And as AI systems inherently consume data, they naturally fall within the GDPR scope of application alongside other data-driven information system. So when it comes to the AI Act, the approach is a bit different. So the AI Act comes from a kind of a product safety and market oversight perspective. And it regulates the development and use of AI systems based on the risks they present, organized into 4 levels: unacceptable, high risk, specific risk, or minimal risks. And the specificity of the AI Act, according to technology, is that it is grounded into, as I said, a market oversight logic, which that means that it has to take into account the way that it will be used in context at the society level, and it is meant to protect not only individual but groups of people.
Can we stop here because we have
no
more than 5 minutes? Maybe we'll come back to it later on. But thank you, Charlotte. I will go now to Derya.
Thank you. Well, there are a lot of different answers to that question, but I think one of the most important points is that at the moment risk is being our sole focus almost, and other criteria that are just as important are being more neglected. I'm speaking about cost effectiveness, I'm speaking about human AI interactions, I'm speaking about user friendliness of the AI applications and their added value. Also speaking about aspects such as what is the intended use, do we need the solutions at all? On the last point, just a very simple example. If I have a pimple and go to the doctor, does the doctor really need an AI solution to tell me that I have a pimple, right? So I'll come back to the first point, so risk. When we focus on the European Union and take a look at the EU AI Act, what we see is that medical applications per se all are being classified as high risk. But this is something where we need to have a more differentiated approach, in my opinion, because if you look at the different applications, we have AI solutions for medical use that are basically only focusing on administrative use. And I think there we can really discuss if such applications need to be classified as high risk, because by classifying an application, a solution, a technology as high risk, we are automatically creating a lot of basically a lot of challenges, a lot of work up for the innovators that are developing those solutions, and that might eventually, or most likely, lead to curbing innovation within the EU, if we think about the consequences of that approach. On the other hand, there are other applications that are, of course, high risk and should be classified as one, but classifying them all as high-risk applications just because they are intended for medical use is not an approach that is sophisticated enough, in my opinion. And then there is this other thing that EU AI is making one single exception to this rule and saying that basically any AI tool that it can be used as a manipulative device, a manipulative tool, is classified as very high risk, and the only application to that is the basically therapeutic use AI tools, which means that those that are being developed for psychotherapy. And this is actually, in my opinion, the one use case that is the highest risk, and ironically, it is the one that is being made an exception for. So I think at least in the European context, we have to really think about our approach in terms of, do we want to put all medical devices in high-risk category, or do we want to take up a more realistic approach based on the use cases? And second, focus more on very important criteria such as cost-effectiveness, human-AI interactions, and transformation of healthcare.
Thank you, Derya. Rossella, can you give your perspective?
Yes, sure. I'm an HTA expert. I'm involved in the EDiHTA. EDiHTA is a EU-funded project whose aim is to develop an HTA framework, an HTA tool to support us as assessor where we face digital technologies, AI included. But I'm also part of the AI-Mind project, another EU-funded project, whose aim is to develop AI tools in order to help clinicians in the assessment of the risk of a patient with mild cognitive impairment to develop dementia. I want to refer to the project to show you how difficult, but also how important is to the evaluation of organizational impact of HTA. We are used to, of AI, sorry. We are used to say that AI will change dramatically their care system, but we still pay little attention to that. In the case of the AI-minded tools, they will be an add-on to the current health technologies that we already imply. Luckily for us, they won't request any additional clinical examination, but that could be not the case for other technologies, and we must be aware of that. This tool will going to change the care pathway of the patients, given that in the case of mild cognitive impairment, at the moment clinicians just monitor regularly this patient. In the future, they will be able to further personalize the care in the intermediate period between MCI diagnosis and dementia. Furthermore, if an hospital will going to adopt the AI tools, that could have implications for the whole healthcare system, because we think that the relationships between the hospital clinical memory unit with the primary care will change, because the hospital will need the help of the GPs to evaluate the adherence to the personalized care that they will be prescribed. So we have to consider all this kind of organizational implication. Then we have to consider also the training that will be requested by the clinician. Clinicians should be able to understand how AI will work and how to interpret the output the AI will provide them. And then there is the issue of communication with patients. Within the AI-Mind project, we conduct a review in order to understand which is now the patient perception of artificial intelligence. And it emerged that patients are more mature than many clinicians and assessors, because patients accept AI, but what request is that clinicians act as a sort of intermediator between them and AI, because they ask to the clinician to say if they use or not AI, and in the case in which they use it, patient asks to the clinician to tell them how much the AI output has impacted on their clinical decision. And then maybe we have to, in the future, take into consideration the impact of AI on the way in which we are going to conduct HTA. It will be very important to plan in advance reassessment of AI-based technologies.
Thank you. Randi, can you share your perspective on the technological factors in AI assessment?
Yes, thank you for having me here. As you can see, I brought snow for you all, happy people.
Thank you.
No problem. But I'm leaving on Saturday, and I think I will bring the snow along with me. At the Norwegian Center for eHealth Research, what we believe is that AI-based systems, they are made, or they are capable of being health system transformators more than just a set of technological devices. So the use of AI solutions will bring big changes on several levels, and therefore also the AI assessment must go beyond the technological and the cost aspect, but include or do a holistic analysis of its entire value in a real-world context. So the need for good technological conditions for innovation is a must-have, and we need European standards and the possibility for us researchers to access data on a European level for the researchers and also for the clinical purposes.
Thank you. So maybe now a few questions. First for you, Derya. When it comes to bias and perspective on promising AI use, how to deal with this risk of bias in general, from your perspective?
Sure. Well, obviously there is a lot of discussion around bias, and there is also a lot of research around bias. And what we see is that basically the tools, I'm going to repeat cliches, right? So what goes in comes out. And if bias data goes into a model, bias results, bias outcomes, bias models come out. But the point there is bias according to what criteria and bias against which groups, right? Because you can always analyze the data or the outcomes or the model in a way that is going to be biased for a certain population or for a certain outcome. So there it's really very important to have very clear criteria on for what purposes the solutions are going to be used, and for the purposes that it's intended to be used, is it going to be biased? And for the populations that it's going to be employed for, is it biased? So those two questions are the key questions, because otherwise, if we go on cherry picking, there are going to be, for any model out there, there is going to be bias, because there is no data set that reflects the 8 billion people on this earth. And as long as we don't have that data set, we can't have unbiased models. So this is basically the technical truth.
Very clear. I had another question also for you, Rossella. You're the HTA expert. When it comes to the economic consideration in AI development and implementation.
Yeah, it's a great point, because maybe some of us have read the high level of cost associated with the training of ChatGPTs or of Gemini's Ultra, but we have to consider, for instance, for the perspective of hospital as mine, where we have dedicated a full department to the development of a ad hoc tool that are able to respond to our hospital clinical need. Let's manage the volume of our investment. In that case, we are able to dedicate a full department to AI development because we have already invested for more than 15 years in the creation and maintenance of the hospital data warehouse. So now we have the data and we try to exploit it. Obviously, not all the AI tools that we have in the hospital are created by us. We paid for other AI-based tools developed by others without any kind of reimbursement currently from the health system. Anyway, we are able to cover the cost of development and the cost associated with the buying of technologies thanks to agreements with industry or a national or a European funded project. But that for us is possible because we are also a recognized research institution. So we have to keep in mind the different kind of costs, and we have to work on the sustainability and negotiate not only with industry, but also with the Ministry of Health, some kind of reimbursement.
Thank you. One question for you, Randi, about digital adoption. How do you think we can ensure inclusive adoption of digital healthcare technologies?
That's really, really difficult because, you know, digitalization is already on hyperspeed and people have been falling behind for decades already. And now with the entrance of AI and everything, even more people will fall behind. For example, in Norway, which is a hyper-digitalized society, we think that 1 in 5 people is non-digital. 1 in 5 people in a country like Norway. And it's not only because they are not capable of being digital, it's also because, for example, for an old person, when the interfaces changes, they will not be able to find the buttons where they previously used to log in and things like that. And it's also a problem with language, it's a problem with the level you are on in society, if you have the money to buy the equipment that you need. And also it's it's a challenge to include non-digital citizens in the creation of the digital solutions, because we as a research center, when we go out and search for participants in our research project, we do it digitally. And then of course we won't reach the people who are not online. And just a funny story to end with, it's a city in Norway where I live. I visited them and I saw that they had lots of roll-ups and posters about chlamydia, which is a big problem in young people. And I was asking them, why aren't you not going on TikTok to inform the young people? And they were like, yeah, we're not allowed to go on TikTok because we're a public service. And the young people, they are not on LinkedIn, they are not on Facebook, they are even probably not even more on Snapchat. So what they did is that they printed paper posters and paper roll-ups to reach the unreachable young people.
Oh, thank you. A last question to you, Charlotte. Maybe the most difficult about explicability and transparency of access to AI tools.
Yeah, absolutely. This is a key concept of both GDPR and AI Act, actually. There is this very big distinction between symbolic systems and more statistical systems, which are both parts of the AI scope. And this is really, really difficult in the case of statistical systems. So we know this, but we have still a transparency obligation, both from data protection and from AI Act. What I would like to stress is that this transparency requirement has to be thought at 2 different levels, towards the user and towards the deployer. So this is not the same thing. For example, when you think about automated decision, and there is a lot of automated, decision-making help in a health sector. For example, diagnosis, imagery, reading, etc. And so you have to think, how can I be able to make human oversight in practice? How can I be able to implement human intervention if I do not know how this system is functioning, if I do not know from what is going this output? So I really would like to stress that this is important for the implementation of human oversight, but also transparency towards the person and the user. So this is really, really the key concept.
Thanks a lot. I think we are coming at the end of this panel. I would like to thank you all much for being here today with us and sharing your perspective on some ideas for EU standards when it comes to using AI in the health field. So I suggest that we end here because we are almost at the end of the time and there is no more time for questions now. But thank you again. And I would like to ask the public to applaud this panel because I think they did very great insights.